In your experience as a what do I have down in your expertise?
Lisa Heffer has no idea what field these witnesses are in. She doesn't seem to care that over 10,000 people were jailed in quarantine when the ArriveCAN had a glitch. Her only point is that there was no data breaches. One witness shuts her down and explains to her the cost of trust. Here's the clip.
Through you to Mr. Malone, I heard you talk about breaches to the app, but then you went on to describe faulty quarantine notices that went out. So it wasn't that it was a breach of data or personal information. It was 10,000 false quarantines that went out to people, which is about 0.03% of the 30 million times that it was used. So I'm wondering if you have any evidence of data breaches or personal information being leaked from this app.
There is one processed access to information request, which I believe dates from the summer of 2021, which is viewable.
So you've got a request out, but you have no information at this point?
No. There's one request which is not mine, which is already processed, which confirmed that as of summer of 2021, there had been no breaches. And then I put in a request for confirmation from the CBSA's media unit in early September, and they also confirmed that there were no data breaches. So that's separate from my outstanding request to know more about the studies that were done to prevent data breaches. So far, I've heard that there have been no breaches of the app as of September 1st, 2022. And that is separate from the glitch that sent those erroneous quarantine orders.
Okay, thank you. That's helpful. And Ms. Wiley, I was listening to you talk about how ArriveCAN is sort of closed code, and you've been advocating that it be open code, that people can understand it better. To quote Mr. Barrett, at the OGO study that revolved around these same sorts of things, the app contains biometric, personal, and health information of more than 8 million people who downloaded the app. And Mr. Barrett was concerned about hypothetical bad actors who could build in a backdoor access to this information in the future. He said there's a lot of ways that foreign state actors can test our systems and our processes. This looks like a great opportunity for them to do that. So do you agree, based on this sensitive information, that this app should have been developed with the highest degree of sensitivity and the most constraints around our personal information?
Making the code base for the app closed doesn't create the security that I think you're suggesting. So, of course, it should be well developed, but it could be well developed and with an eye to what is being collected and used, but still be open source code. The mechanics, the underlying code, the architecture, how it works. There's no reason, there's no problem with that being open and also with it serving the purpose that it served.
Okay, so you don't see any privacy concerns with that. So this study focuses specifically on the costs associated with ArriveCAN and the handling of personal information. And you've talked about how there should have been from the beginning redundancies so that people didn't have to use the app. But I'm wondering if you took into account how much it would have cost to have all those redundancies put in from the beginning.
Yeah, I definitely did, and I don't think you can put a price on trust. I think the damage that this app did to public trust, it would have been worth, you could have tripled what was spent on ArriveCAN to make sure that kiosks were updated or that we were staffed.
You did crunch the numbers? You do?
No, what I'm saying is, no problem. But okay. However much it would cost to not have lost this trust would have been a worthwhile investment.
So, and you don't know of any breaches of personal data or privacy that came from using the app?
I do not know of any, no.
In your experience as a what do I have down in your expertise, what challenges would exist to ensure the integrity and safety of the data that people provide to a company, or in this case, the government?
Yeah, the best principle is always data minimization, and this is why I keep repeating. What was the public health rationale for ArriveCAN to be developed as an app? I don't understand what the public health rationale was for this app.
So that wasn't my question. I wondered if you could explain to us from your expertise, how do you ensure the integrity and safety of the data that people
So the first
provide?
piece of this, sorry, it's not clear. I didn't make it clear enough connection. You minimize, as a first step, data minimization. So you don't collect it if you don't need it. And so this becomes the question here in terms of what was collected and how was it used by the Public Health Agency of Canada. I don't know. But if it was necessary to have that information, then you get into all your sort of basics in terms of storage, who has access, which we have, as Matt has mentioned. Like, we have good policy for how to design secure architecture. So I don't, I'm going to keep going back to the first point, which is you don't want to hold data unless you really have to.
Okay, thank you. I think my time's up.
Thank you.